Hey guys, Dr. Austin Chang here. I just wanted to jump on today because it's been a while and talk about the imminent closure of one of the biggest teaching hospitals in this region, Hahnemann University Hospital. Some of you may have already heard about this. It's affiliated with DREXEL University, so it's a major teaching hospital, and I am not affiliated with DREXEL University. I don't work for DREXEL University. I work for one of the other teaching hospitals in Philadelphia. But this is just solely my opinion and it's not representative of anyone else's. I'm not a health economics expert, nor am I an expert in health policy. This is just sort of seeing it through the lens of a doctor and what it potentially means in terms of impacting the patients in this area and the trainees in this area. So if you're interested in hearing more, please keep watching. So actually, I don't feel like I've heard of a whole lot of big teaching hospitals getting shut down. I know that there's been a lot of consolidation in recent years of hospitals getting bought up by bigger systems and becoming part of bigger hospital systems. But to hear about a teaching hospital actually getting shut down, I think hasn't happened all that often. I know that when I lived in New York a couple years ago, St. Vincent's was one of them. I know that there have been several acquisitions of hospitals by other bigger health systems, as I mentioned. But this clearly was a situation that didn't work out for Hahnemann, and now we're seeing a big hospital close down. And I think that there are a couple lessons to be learned from this. This is a reason why I'm jumping on here, is because these are sort of my reflections through the whole situation. From the numbers that I've read, that means 2,500 or so employees losing their jobs, including several hundred of those who are trainees, medical trainees like residents or fellows who have to find other places to train at. And it's kind of hard because I can imagine for someone like me who's an attending, it might be easier for me to find a place now that I've gone through all my training. But if I haven't completed all that training and now I have to find a job somewhere without, the complete training, I can see how it could be really, really difficult. So that's one thing, is that the training situation, I'm sure, is really hard to figure out. And hopefully we see one of the lessons learned from this is that the hospitals in the area can perhaps step up and absorb some of these trainees, figure out a way that everyone can continue their training without being displaced in such a horrific way. And I know that at our institution at Jefferson, we have an online form that people can fill out if they are looking for another place to train, where they can fill out all their information and potentially get placed or get an interview somewhere within Jefferson and some of the other hospitals in the area. So that's definitely a major step for people who are suffering from this closure. The second thing that I've been thinking about is how this is clearly a public health emergency. When a hospital shuts down, it's not just the people who are losing their jobs, but it's also all the patients who are getting displaced. This hospital was serving a certain patient population, disadvantaged or on Medicaid, who now have nowhere to go. Or even more concerning, some of these patients were followed by experts for years and years, and now they have to transfer their care and bring their stacks of medical records to another hospital and start from scratch and have another doctor sift through all of that medical paperwork just to better understand what their chronic condition is. So it could really spell a lot of problems for those patients. The other thing is that when patients can't get medical care easily, it could really wreak havoc on an entire community. Because if you think about it, without that, what we call a safety net hospital, it could really have a ripple effect on what these patients and their families were suffering from. Now the families are also being impacted that they're getting involved with. It might impact the kids who belong to those families, having to deal with a patient at home, a family member who is sick and doesn't have somewhere to go as easily. So how this could really trigger a domino effect on so many patients and their lives. And the third thing that it's got me thinking is that as much as we think about how we don't want money and medicine and healthcare coming together, the business side of medicine is so real, and it's something that we're not taught much of in medical school or throughout medical training. And it's clear that when there's not enough money coming into a hospital system to pay for the services that are going out, especially with a patient population that are very sick, it could really be a big problem. So therefore the hospital can't afford to keep providing those services in a way. And I know there's a lot of controversy over how this is being handled, and so I'm not going to get into that because I don't know all the intricacies. I'm not an insider into the situation. I know that the city of Philadelphia has been communicating with the hospital and trying to figure out ways to help them out. It does sound like shutting down an entire hospital without trying to at least, scale down or something is really, really drastic, but I really don't know the ins and outs of it. But it's something that moving forward, I think that's been a huge controversy, I think, throughout our country, is how do we curb the costs of healthcare, because it's rising year after year, the amount of money that we spend on healthcare costs, and yet we still want to be innovative and we still want to provide the best care possible. And so that's a whole political discussion that I'm not going to get into, but it's clearly something that's really important that we all have to understand as doctors, because a lot of the decisions that we make could impact the costs of healthcare that are, stacking up. And the last thing I want to mention is for all the residents and fellows who are being displaced as a result of this, I totally feel for all of you, because I was in your shoes not too long ago, and think that someplace as reputable as Hahnemann is being shut down is pretty surprising, and I'm sure that a lot of people didn't anticipate this coming, but at the same time, it sounds like this has been going on for a couple of years. Whether it's been more under wraps, I'm not sure, but I think it's a reminder to all of the students and future residents and future fellows out there to really, do their research and ask questions, on the interview trail to try to figure out, what the stability of a hospital is. It sounds like Hahnemann has been losing money for the past decade or so, and so that really should go into your decision making, perhaps, when you're thinking about, is this place a place that's stable enough that I'm not going to be shut out of my training halfway through? So it's something that did cross my mind when I was going through the application process, and maybe it should for everyone else moving forward as well, if that hasn't been something that you've thought about. So, we'll see what happens. It sounds like the actual closure is a few months from now. I'll keep you posted if I do hear anything about this, or if there are any other developments that I've come back with any reflections about. But so in the meantime, if you like this video, please give it a thumbs up. Don't forget to subscribe to my channel by clicking on the red button below. My social channels are all at Austin Chang MD, and you can visit me on my website, austinchang.com. So until next time, please stay healthy, and I'll see you guys in the next video. Bye, guys.